Hello, I'm Gabrielle Olsofsky, and I'm doing my symposium on type 2 diabetes among youth. For my selected disease and population, I've chosen the burden of type 2 diabetes among youth. This includes young children and adolescents suffering from or at risk of developing type 2 diabetes. Type 2 diabetes is defined by insulin resistance, impaired insulin secretion, and hyperglycemia. The rate of this disease has continued to rise in recent years, with an increase from 9 cases per 100,000 in 2002 to 2003 to 17.9 cases per 100,000 in 2017 to 2018. This rise in cases has come along with a rise in childhood obesity worldwide as well. The main risk factors for type 2 diabetes among youth are genetics, puberty, and lifestyle factors, mainly diet and exercise. High BMI is a great indicator for the risk of type 2 diabetes, as it is estimated that 1/6 of obese youth have developed prediabetes. Type 2 diabetes is more prevalent among children of ethnic minorities and disadvantaged socioeconomic groups. These populations are disproportionately affected by the disease. Across all groups, youth-onset type 2 diabetes has poor prognosis and other treatment challenges when compared to adult-onset type 2 diabetes. This involves earlier diabetic complications such as higher risk for cardiovascular disease and mortality, an accelerated decline in beta cell functions, and a higher rate of insulin resistance and therefore therapeutic failure. This is a diagram of some of the disparities of type 2 diabetes in youth. It shows the ratio of boys to girls affected, and that in Western countries, the rate tends to be higher in girls, but in other parts of the world, there is an opposite trend. It also shows the disparities based on socioeconomic status. In Western countries, low socioeconomic status is associated with higher rates, and once again, the opposite is observed in other parts of the world, specifically in developing countries. Based on the studies I've researched, the best community-based intervention involves a family or community-based group that encourages involvement in physical activity sessions and nutritional and behavioral education. One study, the Bright Bodies Weight Management Program for Children, was an intensive family-based program for youth at risk of developing diabetes or suffering from prediabetes. This approach focused on nutrition, exercise, and behavior modification. This intervention resulted in decreased BMI, insulin resistance, and cholesterol in obese youth, and reduced 2-hour glucose levels in those with prediabetes. Another study, called Powerhouse, was a 16-week intervention involving at-risk youth and their families. This intervention was similar to the Bright Bodies intervention, as it involved the participants in weekly physical activity classes and nutrition education sessions. These groups focused on creating an affirming and positive environment that participants indicated they would like. Overall, the study resulted in an increase in participants' physical activity and quality of life while maintaining BMI and HbA1c at manageable levels. These interventions show the benefits of community-based approaches that target modifiable risk factors. In both interventions, the change in physical activity and nutritional education led to positive results in reducing the risk of type 2 diabetes in the youth involved. By incorporating interventions like these into communities with youth at risk, the burden of diabetes among youth could be reduced within the next 10 years. These tables show the outcome of the Powerhouse intervention. This is the data that was collected on the levels of BMI and HbA1c at the beginning and then 4 and 12 months into the programs. You can see the maintenance or steady decline of these levels across the children and their caregivers that participated. There is also the data collected on the physical activity rate and quality of life measured in the same increments. Across the table, we can see a steady increase in both of these in both the children and their caregivers. These results show the effectiveness of interventions such as Powerhouse. These are my references. Thank you for listening.